months and months. So we kept thinking about it, but again, as she went through this so acutely, it was an medical emergency. We wanted to do whatever we could because the docs kept telling us, if she gets sick, take it seriously and take her right to the hospital, because if she complains of belly pain, she could have peritonitis or she could have this. And, you know, so whenever she complained of something, I was terrified. And what really made things more complicated is when they started to taper the prednisone, that affects your immune system so much, but it was complicated by repeated bacterial infections. She had a bad ear infection, a couple bouts of strep throat, and all of these things would just make the, would just make her need more and more steroids. So at this point, we thought about it, we prayed about it, and we decided we were going to try something different. And this was real different because I'm a nurse and work in a big medical center, and when you feel like you're stepping out of the paradigm and doing something against what you've practiced for years, it was really hard. But as a parent that wanted my child to be better and not feeling total satisfaction or comfort in what we were doing, I felt like we had no choice but to do something different. So we made an appointment and went to see Dr. Mueller. And the appointment, I agree with it, was a great appointment because the first thing is he listens so well, and the questions they ask. I've never heard of such questions in my life, but I felt like when I left, he knew so much about my child, and he knew more about our life and our family history, and the things that he asked just made such good sense, and they clicked. And, usually, with the various things that are going on, you might get 15 minutes with your primary care physician, but we were in there at least an hour, and I'm sure much longer than that. But when I left, I had such a good feeling because I felt like something was going to happen better and different. And at least we just had to give it a try. So after talking to him for a period of time, he said that based on her medical history, Catherine had, and she did have allergy symptoms. Every fall, every change of season, she was on medicines for allergy, and she'd always end up on antibiotics throughout the course of that as well. So he diagnosed her underlying allergies as the culprit of everything that was going on, and because we continued to suppress the symptoms and treat her with all these other things, something else was going on in her body. And she started, I think APHIS was a constitutional remedy, and we started a course of cleansing remedies to get rid of all the other medications she had been exposed to over time. So we did a slow taper, and within 2 weeks she was off everything, and she didn't have any problems. And for the first couple of weeks, her urine was still the same, she was spilling. But within 3 weeks, her urine was clear of any protein. She spilled protein no longer, and she was okay. And we were still doing the treatments for a number of weeks, a few months actually, and she did fine. But it was the first month or so was so uncomfortable because I called her primary care physician and I told her what we did. And the first thing she said to me is, I pray it works. And then the next thing, it was something that she just didn't know that much about. So she called me back the next day and said, well, I understand why you need to do something different, but I'm advising you to, keep her under our care. And I just said, well, we're not going to let her get sicker without getting emergency help if something happens. But I felt like we needed to commit to this and see what was going to happen, because I just felt compelled that she was going to get better. And she did. And it was in August of 1997 when Catherine first went to Dr. Mueller. And usually every year, she was in the 3rd grade then, now she's in the 4th, but every year during the first week of school with the seasons changing, she had always been on an antibiotic and sinus medication because allergy symptoms were always acting up. She's not had a bout since then. This fall, when she started having problems, she was given a remedy which resolved her symptoms. In a year, she had not had any kind of medication, prescription, or over-the-counter at all. She was totally healthy. Just a month ago, we did have 1 bout of strep throat. But other than that, she seems healthier than she's ever been. It's the first time in her life that she's been a year without any symptom, any medication. And remedies, whenever we had symptoms of anything in particular, we call Dr. Mueller, take her in, or talk to him to get remedies to manage her. So I feel that we've got to claim that what's happened, and it's been a year into all of this, and as quickly as it happened, it's gone away. So my husband and I both feel that she's cured.